Welcome to DermWire News, powered by PracticalDermatology.com. I'm Stephanie Talea. Results from a Phase 2 open-label clinical trial of ATI-502 AGA-201, an investigational topical JAK1-3 inhibitor, are promising for patients with androgenetic alopecia. Aclaris Therapeutics announced the findings and says 12-month data should be available by year's end. The trial evaluated ATI-502 in women and men with AGA. Subjects aged 18 to 50 years applied ATI-502 to their scalp twice daily for 26 weeks. 23 subjects completed 6 months of treatment. 20 subjects had evaluable hair counts and 22 recorded investigator global assessment and subject self-assessment scores. The primary endpoint was the mean change from baseline in non-vellus target area count at week 26. The overall change was an increase of 8.6 hairs per centimeter squared. TAHC increase was 15.3 hairs per centimeter squared in female subjects and 5.6 hairs per centimeter squared in male subjects. The secondary endpoints included an IGA and SSA. Subjects who experienced increased hair growth were given a score of +1 or better on the IGA and SSA. Based on these endpoints, investigators rated 73% of subjects as experiencing increased hair growth, and 82% of subjects rated themselves as experiencing increased hair growth. ATI-502 was well tolerated. There were no treatment-related serious adverse events. There was one unrelated serious adverse event of breast cancer reported, and one patient withdrew from treatment-related alopecia in week 1. Aclaris says that the recent formulation allows the company to achieve significantly higher topical concentrations of ATI-502 and hopes to initiate a double-blind, randomized controlled Phase 2 dose-ranging clinical trial with higher concentrations of ATI-502 in the first half of 2020. That trial may be female-focused. A new comprehensive analysis shows the long-term efficacy and safety of secukinumab in multiple manifestations of psoriatic disease, including moderate to severe plaque type, nail and palmoplantar psoriasis, psoriatic arthritis, and ankylosing spondylitis. Data are derived from key Phase 3 randomized double-blind trials of secukinumab in a total of 1,872 patients. Findings were presented at the World Congress of Dermatology in Milan. These data across multiple manifestations of psoriatic disease, including persistent manifestations, psoriatic arthritis, as well as ankylosing spondylitis, provide much-needed additional guidance for prescribing dermatologists who want to treat their patient in a comprehensive way, says Richard Langley. Another abstract, secukinumab, a fully human anti-interleukin-17A monoclonal antibody, exhibits low immunogenicity in psoriasis patients over 5 years, also presented at WCD, investigated the immunogenicity of secukinumab treatment up to 5 years in 2 Phase 3 extension studies in patients with moderate to severe plaque psoriasis. In total, 1,821 patients entered the extension studies. Results of the Phase 3b/4 SPIRIT head-to-head study in patients with active psoriatic arthritis presented as a late-breaking abstract at the European Congress of Rheumatology in Madrid, show that a significant higher proportion of patients met the primary endpoint at week 24 compared to those using adalimumab. The assessor-blinded randomized controlled trial is the first and only head-to-head study that utilizes on-label dosing for both Taltz and Humira and allows inclusion of concomitant conventional DMARDs. Top-line results from the study, which demonstrated Taltz met the primary and all major secondary endpoints, were announced in December 2018. The primary endpoint of the study was superiority of Taltz compared to Humira in the proportion of patients who simultaneously achieved a reduction by at least 50% in disease activity as defined by the American College of Rheumatology and complete skin clearance as measured by PASI 100. Key secondary endpoints included non-inferiority in the proportion of patients who achieved ACR 50 and superiority in the proportion of patients who achieved PASI 100. 566 patients with active PSA were enrolled in the SPIRIT H2H study. Patients were randomized to receive Taltz or Humira at the approved dose for PSA for a total of 52 weeks, with the primary analysis conducted at 24 weeks. PSA patients who also met the study criteria for moderate to severe plaque psoriasis received Taltz or the approved dose for psoriasis. At 24 weeks, the proportion of patients achieving both a reduction by at least 50% in disease activity as well as complete skin clearance was significantly higher for Taltz than for Humira. Taltz also met the key secondary endpoints, including non-inferiority compared to Humira for the percentage of patients achieving ACR 50, and superiority compared to Humira for the percentage of patients achieving PASI 100. In Spirit H2H, the safety profile of Taltz was consistent with previously reported results. Thank you for listening to DermWire News, powered by PracticalDermatology.com.